Good afternoon. We'll start now. It's 2 o'clock. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include the names of your companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. As a reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. Beth and I have placed the link in the chat box and also in the Viber group, as well as in the Facebook group. Another reminder is that 50 OLETE certificates will entitle one to a voucher for a ROJoson telemedical consultation. Let's now have a group picture taking before we start the pep talk in a few moments. Okay. Ready? Where's the face of Jeng? Melingo. Ipahabol. Okay, we'll wait. Show your face, Melly. Very good. Okay, ready? 1, 2, 3. I have a patient empowerment program, which I like to empower the lay people for patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in the Medical Management of Pancreatic Disorders. An overview. This is part of the health disorder course. The empowerment objective is for the lay people to have an understanding on the fundamentals and generalities in the medical management of pancreatic disorders. The contents of this pep talk on pancreatic disorders will be the following. What is the pancreas? What is a pancreatic disorder? What are the different types, causes? How common is a pancreatic disorder or are pancreatic disorders? Clinical diagnosis of a pancreatic disorder, paraclinical diagnostic procedure for pancreatic disorder, basic treatment modalities for pancreatic cancer, then an overview on pancreatic cancer. So let's start with the first topic. What is the pancreas? The pancreas is an organ located deep in the upper part of the abdomen, okay, in the epigastrium, okay, or the belly, and it's located behind the stomach. Okay, this is the stomach, this is the pancreas. Okay. Again, this is the liver, the stomach, and then the pancreas is at the back. Okay. The Tagalog term for pancreas, I think, is lapay. Lapay. Okay. The pancreas can be divided into the head, neck, body, and tail. Okay. So it's important to know this because symptoms will be dependent on the location of a particular pancreatic lesion. Example, if the pancreatic tumor is located here, you will have prominent symptoms of jaundice, okay? Whereas if it's located at the tail, you won't have the symptom of jaundice, okay? So it all depends on the location of the tumor or any lesion for that matter. And it will influence the occurrence of symptoms. The pancreas is an organ of the digestive system as well as the endocrine system. As part of the digestive system, it plays an essential role in converting foods that we eat into fuels for the body cells. So it usually helps in the digestion of fats. As part of the endocrine system, it plays an essential role in regulating the blood sugar. Thus, it has two main functions. Majority of the function is labeled as exocrine function. 99% of this their total function is that it's an exocrine gland, okay? And it helps in the digestion of food, okay? And only 1% of the function of the pancreas is an endocrine function, in that specifically and particularly it regulates the blood sugar, okay? Can one live without a pancreas? Yes, one can live without a pancreas. However, one needs to adjust. Pancreas makes substances, as mentioned, that control the blood sugar and help the body digest foods. So after surgery with total removal, or after a chronic disease that will destroy the whole pancreas, one will have to take medicines to handle these functions. So what is a pancreatic disorder? First, the meaning of disorder, to differentiate it from a disease. A disorder is a definite disruption to a regular bodily structure and function, but the specific cause is not yet determined. Now, once the disease is identified, or the specific cause is identified, we call that cause the disease. So that's the difference between disorder and disease. So pancreatic disorder is a disorder of the pancreas. There is definite disruption to the usual bodily structure and function of the pancreas, but the specific cause is not yet determined. Once the cause is determined, then we label it as a pancreatic disease. What are the different types of pancreatic disorder? Generally, three types, three disorder. Okay, there are many diseases, but three disorder. One is pancreatic tumors, which can be cancerous or non-cancerous. Okay, so if we have identified the tumor to be cancerous, then that's already the disease. Okay, and another type of pancreatic disorder is the pancreatic inflammation or infection, which we usually call pancreatitis. Okay, and then the third type would be the pancreatic endocrine disorder. Example will be the disease known as diabetes mellitus. What are the causes of pancreatic disorder? So number one, pancreatic new growth tumors, okay, presenting as a tumor, so which can be both cancerous and non-cancerous. And the basic cause is due to gene mutations. We have discussed this before in cancers, okay. The exact mechanism, as we said, is not yet exactly known. A great concern about the new growth tumors is the pancreatic cancers. Okay. The most common is the so-called adenocarcinoma, okay, the type. Not all tumors are due to new growth. That's why there's such a thing as pancreatic non-new growth tumors. Okay, so if you have new growth tumors, it can either be malignant or non-malignant. Okay, but if you have a non-new growth tumors, okay, which is an example, if you have a cystic degeneration because of aging process, because of wear and tear, it presents as a tumor also, but it is not categorized as a new growth, and it can fall under non-cancer. Okay. Pancreatic inflammation, infection, pancreatitis, the most common cause for this will be gallbladder stones. In the common bile duct, the stone has lodged into the common bile duct, obstructing the pancreatic duct, thereby causing inflammation of the pancreas. Another common cause is excessive alcoholic intake. Okay, so these are the two most common causes. Pancreatic endocrine disorders, I won't go into this, but mind you that the most common disease, probably all of you have heard about, is diabetes mellitus. Diabetes mellitus. So if you have diabetes mellitus, most of the time there is a pancreatic endocrine disorder. How common is pancreatic disorder, or are pancreatic disorders? They're quite common, and you cannot say that they are rare. Okay? We have often heard of people suffering from pancreatic disorders. Okay? So pancreatitis is more common than pancreatic tumors. Okay? At the moment, I don't have specific data, but based on experience, pancreatitis is more common than pancreatic tumors. Okay? And of course, the most common is still your diabetes mellitus, which is due to a pancreatic endocrine disorder. This is the most common. Clinical diagnosis of pancreatic disorder. So let's focus on pancreatitis and pancreatic tumors. I won't discuss diabetes mellitus now. So clinical diagnosis of pancreatitis. The pattern recognition cues will be a patient with pain in the upper abdomen that radiates to the back. Earlier, I mentioned that the pancreas is located deep in the back, okay, behind the stomach. Okay, so that's why the pain usually radiates to the back. Okay? And the abdominal pain worsen after eating, especially foods high in fat. And then the abdomen is tender to touch. If you press on the abdomen, there is pain and tenderness. The patient may or may not have fever. So these are the pattern recognition cues for pancreas. The most important is once you have this one, pain in the upper abdomen that radiates to the back, you start thinking of possible pancreatitis. So this picture illustrates the healthy pancreas. Okay. And then this one is pancreatitis or inflammation, okay, of the pancreas. It could be focal, it can be part of the pancreas is involved, or the entire pancreas is involved. Okay. As to pancreatic tumor and cancers, as to diagnosis, clinical diagnosis, let me just say that because of the deep location of the pancreas, most tumors of the pancreas cannot be felt when pressing on the abdomen. Malalim kasi. This leads to late detection, as symptoms of pancreatic cancer usually do not appear until the tumor begins to interfere with the function of the pancreas and other nearby organs, such as the stomach. Okay, remember the stomach is just in front of the pancreas. The duodenum is on the side, the liver a little above, and the gallbladder. Okay. Pancreatic tumors are usually, and cancers are usually not detected clinically, meaning based on symptoms and sign, okay, but with imaging procedures or laboratory tests or instrumental paraclinical diagnostic procedures like the ultrasound, CT scan, and MRI. Patients with pancreatic tumors can be symptomatic or asymptomatic. If symptomatic, if the patient has symptoms, they usually start with a vague abdominal pain at the epigastric area. Okay, at the epigastric area. Okay, so it's very vague, it's non-specific. But the moment you start having an additional clue that it radiates to the back, you now think of the pancreas as a possible organ involved. Patients with pancreatic head, okay. Earlier I told you the importance of the location of the of the division of the pancreas into the head, neck, body, and tail. Okay. So patients with pancreatic head tumors located here usually presents with jaundice because the common bile duct here, common bile duct, may be obstructed, may be in pains, may be invaded by the tumor. Okay. So once the tumor in this area, in the head of the pancreas, impedes on the common bile duct, then preventing biles from going inside the intestine, then you will have jaundice. Okay, so jaundice is yellowing of the sclerae. Another scenario is that patients with pancreatic head tumor, because of its proximity to the small intestine and also to the stomach, the outlet, the stomach, and then foods will go in here and out to the small intestine, duodenum. If the tumor, pancreatic tumor, has gone beyond its wall and then it goes into the small intestine, it go a little up now, then you will have obstruction in the duodenum, or the even the stomach can be obstructed. Okay, that's why it's called gastric outlet obstruction. Paraclinical diagnostic procedure for pancreatic disorder. The common instrumental and laboratory diagnostic procedures for pancreatic disorders are the following. So imaging procedures, okay, ultrasound, CT scan, MRI, PET scan, etc. Okay. Endoscopy, usually upper endoscopy, not lower endoscopy. Okay. Upper endoscopy for the stomach, pancreas, and also the duodenum. So specifically, these are the common endoscopic procedures being done. ERCP stands for endoscopic retrograde cholangiopancreaticography, in which the tube is inserted into the stomach and then to the duodenum and into the opening of the pancreatic duct or even the common bile duct. Okay. And then the other imaging endoscopic procedure will be the endoscopic ultrasound. Again, inserting the tube with an endoscopic equipment inside, and then it will try to do ultrasound, ultrasound equipment, and then do an ultrasound of the area in the pancreas. Other common instrumental laboratory diagnostic procedures include blood tests like the pancreatic enzymes, amylase, lipase, tumor markers like CA19-9, etc. Okay, and then of course biopsy. Biopsy is an example of an instrumental diagnostic procedure. The competencies required for physicians managing pancreatic disorders, because there are a lot of paraclinical diagnostic procedures that can be done, so they must know the uses and indications for each one of them. Okay, and then use them as needed and as indicated. And then they are required to select the most cost-effective one using the BRCA process, not just based on gut feel and what is the most popular. Okay, and lastly, they must know how to interpret the results. Now, this is an example of the BRCA process, which we have been talking about in the past. Okay, B stands for benefit, risk, R risk, C cost, availability. Okay. So there are various options in the paraclinical diagnostic procedures. So the physicians will have to recommend, given all the data here, which one will be the most cost-effective one for a particular patient. And then the patient will have to study them and then see if they want to have it done or not. Usually, an ultrasound is initially done for patients suspected to have a pancreatic disorder, usually. Okay, especially when you're dealing with pancreatitis, then you have upper abdominal pain in the epigastrium and radiating to the back, in which you are suspecting pancreatitis or pancreatic disorder. Okay, then ultrasound is usually done. If you're entertaining diabetes, that's a different story. Okay, so no abdominal pain, just symptoms of diabetes. Usually ultrasound is not done, but the blood sugar is done. So after the ultrasound, other paraclinical diagnostic procedures may be done as indicated, such as the pancreatic enzyme determinations like serum amylase and lipase. Okay. Basic treatment modalities for pancreatic disorder. Okay. So surgical, these are the basic treatment, 3 options: surgical, outright surgical treatment, non-surgical at all times, no need for an operation. And then the third option is potentially surgical, meaning watch and wait first, or medical treatment first. If there is an indications to do surgery, then it is done. Okay. So here is a table that will list down all the possible pancreatic diseases that are known, and then how they are usually being treated. So examples of pancreatic disorder or diseases that needs outright surgical treatment, dapat operahan na kagad, no? Okay, it's a treatment of choice. You have a resectable pancreatic cancer. Okay? So pwede pang tanggalin. If you have a pancreatic cancer diagnosed at an early stage and it can be removed, then outright surgery is the treatment of choice. Necrotizing pancreatitis, this is the severe form of pancreatitis in which there's a lot of infection, dead tissues that you really need surgery. Okay. So the surgery usually being done here is debridement and drainage, okay, for necrotizing pancreatitis. Now for the tumors, usually remove or extirpate, you remove the tumor. Now, if it cannot be removed, then a bypass procedure can be done. Okay. This is an illustration of an extirpation of pancreatic head cancer. Okay. Here, this is the cancer in the head of the pancreas. Okay. So the operation being done is called pancreatico-duodenectomy. Pancreatico, pancreas, duodenectomy is duodenum. Okay, this is the duodenum. This is the pancreas. Okay, so the operation illustrated here is that part of the stomach is removed. The entire duodenum is also removed. And then the pancreas, the head of the pancreas is removed. And then the common bile, since the common bile duct is attached to the duodenum and into the pancreas, it's also partly removed. The gallbladder is also removed. Okay, so it's a major operation. So after the removal of these tissues, these organs now surrounding the pancreatic tumor, okay, there must be a reconstruction of the resected parts, because let's example, after resecting the common bile duct, it must have a channel in which you can drain the bile from the liver. Okay, so this is the remnant of the resection of the common bile duct. The remaining part is attached to the small intestine. Okay, so that bile coming from the liver will still go down here to the common bile duct and into the small intestine. Okay, now for the stomach, if this is resected, transected, so where will the food go now? Okay, so we have to rechannel or make a pathway for the food to go in. So again, we attach the small intestine into the stomach so that when food goes in, it goes to the stomach and then to the small intestine, down to the large intestine, down to the anus. Okay. Now, suppose the pancreas, half of the pancreas or just the head of the pancreas is removed, so you still have remaining pancreas, you have the tail and then the body, okay? So there's still a pancreatic duct there. So the pancreatic duct is draining pancreatic juices, so it needs a channel in which it can drain the pancreatic juices into the small intestine. That's why the remaining pancreas is also attached to the part of the small intestine. So pancreatic duct with juices going inside the small intestine, bile from the common bile duct from the liver going to the small intestine, the food from the stomach going into the small intestine. Okay, so that's how the reconstruction is being done after an extensive extirpation of the pancreatic tumor. Example of potentially surgical treatment in which watch and wait stance is a better option, in which a medical management can be tried first. Acute pancreatitis, a lot of times, if it's mild, it will resolve, okay, with medical treatment, okay. Pancreatic abscess, if it's small, it can also resolve without surgery. Pancreatic pseudocyst, also. Pancreatic benign, non-cancerous pancreatic tumors can also be treated this way, okay. Just watch and wait. Now, examples of outright non-surgical treatment, meaning conditions which do not need surgery. Okay, you have the mild pancreatitis, chronic pancreatitis, because the pancreas has already been destroyed. That you cannot, if you remove all, then it will aggravate the condition. And then for unresectable pancreatic cancer, in which the cancer cannot be resected anymore because of advanced stage, then only palliative treatment can be done, no more surgery. Okay, so example of non-surgical treatment for pancreatic disorders or pancreatic tumors will be medicine, just give medicine, no surgery, or no medicine, just watchful waiting, natural support management. Okay, in cases in which you expect a spontaneous resolution of the condition. So just like in the selection of the paraclinical diagnostic procedures, okay, we use the BRCA process also in selecting the most cost-effective treatment modalities. As I said, there are a lot of options that can be done in the treatment. Then we choose which one is the most cost-effective based on benefit, risk, cost, availability analysis. Overview on pancreatic cancers. Pancreatic cancer statistics in the Philippines based on this 2020 data. It's number 14 in incidence, okay? So number 14, it's not number 1. Number 1, I think, is the breast or even the lungs, okay? 2020, it's the breast, okay? Number 8 in the mortality or death rank, okay? Number 8. And then in terms of prevalence, how common it is, for every 100,000 population, you can have 3 pancreatic cancer coming out. Okay, 3 per 100,000 population. So, as mentioned, usually late detection because of its deep location, and usually they don't have any symptoms. They have symptoms only when they invade already the adjacent organs and structures like the stomach, duodenum, liver, and gallbladder. Okay. So with late detection, it will lead to advanced stage of cancer at the time of diagnosis. And then with advanced stage, it will carry a very, very poor prognosis. Okay, not a good chance to be cured, to survive the cancer. This table, shows the 5-year survival rate. This is in one statistics. You can see that pancreas compared to the other cancer, pancreatic cancer compared to the other cancers, has the poorest prognosis. Okay, 4.6 5-year survival. For thyroid, you still have 96.6. Okay. After 5 years, 96.6 are still alive. But for pancreas, after 5 years, only 4.6 are still alive. Okay. For breast, maganda pa rin breast, 88.2% after 5 years. Okay. Overall, breast cancer patients usually survive, okay, 88.2% compared to 4.6. Another table this time, breaking it into stages already. Pancreatic cancer, stage 1, 2, 3, 4. Stage 4 is the most advanced, and it has the poorest prognosis. Only 1% will survive. Okay, so for the stage 1, you can see still poor. Only 14%, okay, will be surviving after 5 years. Another table shows essentially the same as the second one. Stage 1, you have 14 to 17.6% at 5 years. Stage 4, 1.6 or 1%. And then in terms of the median pancreatic cancer survival by stage, okay. So stage 4, the median survival rate is just about 4, if this is in terms of months, about 4 months, okay. But for stage 1, 2 point something, so it's about 24 months, okay, about 2 years, okay. So from these tables, you can see that the prognosis of pancreatic cancers is very, very poor, okay, because of the usual late detection, and early symptoms are usually non-specific. As I said, you feel a little pain and dull abdominal pain at the epigastric area or sikmura, no? Okay. And then usually there could be some loss of appetite and weight loss will follow, okay. Sad to say, but it's also true for all cancers, causes are usually not exactly known. We always talk about gene mutation, okay. About 10% of the pancreatic cancers, just like other cancers, are hereditary, only about 10%. Majority are acquired. Majority are due to gene mutation, but the exact mechanism we still don't know. So anybody can be afflicted with pancreatic cancer, anybody. Okay. There's no way of telling who will not get it and who will get it. Okay, when and how, nobody exactly knows. And the two general types of pancreatic cancers are the adenocarcinomas, which is the more common, and the neuroendocrine tumors, which are not so common. In general, pancreatic endocrine tumors grow at a much lower rate than pancreatic adenocarcinomas. While each type of the tumor can spread, metastasize from the pancreas to other distant organs, pancreatic endocrine tumor, neuroendocrine tumors are usually spread over a period of years. Screening. So you might ask, can we do screening for pancreatic cancer so that we can try to catch it in the early stage? For pancreatic cancer, at the moment, no major professional groups currently recommend routine screening in people who are at average risk. This is because no screening test has been shown to lower the risk of dying from this cancer. This is at this moment, up to this time, okay? So we hope in the future we can have a more effective screening test. And there is no single diagnostic test that can tell you if you have pancreatic cancer. Usually you have a multiple battery of tests, okay, series of imaging scans, blood tests, and biopsy. And these tests are typically only done if you have symptoms, okay? So there's no single diagnostic test, okay? It has to be, one test has to be complemented by another test. The paraclinical diagnostic procedures that are being done for pancreatic cancers are ultrasound, usually the first one to be done, CT scan, MRI, and then the tumor markers 19-9, CA 19-9, and then biopsy, a biopsy of the pancreatic mass. Treatment, if it's early stage, fortunately, the cancer is caught in the early stage and it's resectable, and with no evidence of distant spread, surgery is the treatment of choice. At the moment, it's still the treatment of choice. It still carries a better chance of survival, but as we said, the prognosis is still not that good, okay? Otherwise, let's say late stage, non-resectable with evidence of spread, then you give chemotherapy and no more conventional medical treatment, just palliative and hospice care. Okay. Now, after surgery, some would give adjuvant additional chemotherapy just in the hope of improving the survival rate after surgery. Okay, summary and takeaway in this pep talk. What is the pancreas? I've discussed this. what is a pancreatic disorder, different types, causes, how common, clinical diagnosis, paraclinical diagnostic procedures, basic treatment modalities, and overview on pancreatic cancer. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on the fundamentals and generalities in the medical management of pancreatic disorders. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of pancreatic disorders. So with that, I end my pep talk for today. I hope I have empowered you to have a better understanding on the fundamentals and generalities in the medical management of pancreatic disorders. Before we go to the QA session, let's take, a reminder, please take the online Learning Cum Evaluation Test exercise or OLETE for Mastery of Learning and have a perfect score to get the certificate. 50 OLETE certificates entitles one to a voucher for a free ROJoson telemedical consultation. So let's now have a group picture taking before we go to the open forum. Okay. Ready? Show your face. Okay. One still missing. Anyway, let's go. 1, 2, 3. Okay. The floor is now open for questions, comments, okay, suggestions, consults, short consult. We'll still we allow that. Okay. Okay. Who has concern with pancreatic tumors? Who are very interested in pancreatic tumors or pancreatic disorder for that matter? Pancreatic. Anybody? Okay, Chuchi. Go ahead.
Pancreatic disorders are caused by much eating because it usually happens to pollutant or they eat so much, and also they say nabangungot kasi masyadong busog. I mean, this is a myth. It's a myth.
Yeah.
But a lot of people used to believe that it was true. That I'm one of them. My nephew died of pancreatic inflammation. I guess he was careless. He was careless, and I think he had a big problem with a wife or something, and so he was binging on alcohol, nag-alcohol, and then
okay.
Yeah. So nobody knew. He disappeared. I mean, I don't know where he went, but he disappeared. This is the son of my sister.
Okay.
No? And then we just heard that he was in the hospital already dying in Antipolo. Yun. So
yeah,
it's too bad because he died immediately after that. So he was really careless, I guess. No?
Yeah, careless. Okay, probably he doesn't know He's not empowered. Okay. So
Because
eating a lot of,
what you're telling us now is you can also prevent it by taking care of your, if you feel something like, kunyari, meron ng vague pain in the abdomen, or maybe dapat noon pa lang nagpapatingin na siya.
yeah. Okay.
Eh,
Or
So that's
before,
just a side comment.
yeah. Or before going to requiring people to go to see a doctor, the first requirement is to listen to your body very closely. Do not just dismiss anything. If you have big abdominal pain, start monitoring it very closely. Okay, so monitor it, see if it's progressing. No, okay. If there are other associated symptoms, but think of all the possibilities already. Sorry to say that's a part of our that's part of our hardship. Now, once we develop some symptoms, we're anxious already. We think of a lot of possibilities, right? Okay. So anyway, it's a good thing to do so, to think of all the possibilities, and then just control your worry for the moment, but do a close observation. Close observation. Okay.
Yeah, Doc, I remember, I don't know if you're familiar with Rico Yan. That was also a pancreatic disorder.
Who?
I know the family, and it happened to him while he was sleeping.
Yeah. So
And nag-ano daw na kumain ng marami because he was on an excursion or something. They went to some place and spent the night over. Maraming kinain. That's why I've always thought that it's because of the yung kinain mo. Where apparently,
yeah, the food that we take in general, if I may recommend, if I may advise you, is risky. It's risky. No? So just number one, choose the foods that you're gonna eat muna. Okay, make sure that it's not panis, it's not spoiled. No, okay. Then number two, if it's not spoiled, no, take take everything in moderation. Huwag masyadong marami. Di ba? Okay. The moment you take in a lot of foods, and then saksak po ng alcohol pa, and then you might develop some problems in your tummy. Di ba? So kumisan gastroenteritis, food indigestions, and at times pancreatitis. No? Okay. Okay. So the moral here is we need food to survive, but we must know how not to abuse the intake of the food. No? Okay. Konti-konti lang. Hinay-hinay lang. No? Okay? So, any more questions? Del Rosario, okay. Mark, Gino, you have anything that you want to ask? Okay. So who has a problem with stones causing pancreatitis? Wala pa naman, I hope. Yung kay Christine, na-operang kagad, di ba? Kay Christine, she underwent cholecystectomy. So most likely it aborted some of the complications of pancreatitis. No? Okay. So who has concern with pancreatic? Let's not discuss diabetes. It's not my line. Medyo malawak yan. No? Diabetes. Diabetes is part of the pancreatic disorder. No? Okay. Let's just focus on pancreatitis and pancreatic tumors. Okay. Recently, I have a patient, 69 years old. He has some kidney problem, And he was just asked by his urologist to have a yearly ultrasound of the whole abdomen. For the past 5 years, he has ultrasound of the abdomen, negative, 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 negative. 5 years, 2000 up to 2019. 2020, because of the pandemic, he did not have a ultrasound for that year. And then 2021, he did not have an ultrasound. And then 2022, January, okay, she start having symptoms, no? Okay. Upper abdominal pain. And then when the ultrasound came in, no, she already has a pancreatic tumor as big as about 4 centimeters already. And then with metastasis to the liver. Okay. So this is very unfortunate, no, but it also shows that you cannot really predict now what will happen. Okay. So every year nagpapa-ultrasound. Yeah, I felt so bad also when you told me every year nagpapa-ultrasound ako no? Okay. So when you have ultrasound, we usually expect that if you have a development of something, a disorder, dapat early na yon, di ba? Dapat early pa. But sa kanya, within 2 years, no, spread to the liver already, no? So then an example of how unpredictable our diseases that
Dok, natakot sa pandemic kasi.
natakot siya sa pandemic without with siya mismo, pero yung pancreatic CA hindi ito natakot. So any question? We still have 3 minutes. Any question on the chat box, Abet? Ladies, any question in the chat box?
No, there's nothing at the chat box.
Okay. So nobody would like.
There are no questions sa chat box.
Yeah. Okay.
Doc, parang na talagang may sinabi kayo na mahirap kapain.
Yeah.
Kasi nasa likod ng
Malalim.
Tama po yun. Kung may tumor or mass sa mahirap kapain. Kasi yung namatay lang yung yung kaibigan ko 2 weeks ago, na-discover nung December lang na may tumor siya. Tapos namatay.
Pancreas.
Opo. Cancer.
Okay. So
hindi na ewan ko kung may nararamdaman siyang sakit, pero hindi naman niya nakapa or what, wala.
Usually late nga eh. Pero anong nangyari? Nagpa-opera siya?
Hindi na po. Namatay na siya. Namatay. May komplikasyon din na diabetes siya.
Okay. Good. Okay. Good in the sense that 2 months lang, no? 3 months? 3 months?
Yun hong cancer, yung tumor sa pancreas niya, noon lang nalaman na meron pala.
Nung nalaman, then she died 2 to 3 months after.
Opo. Noong December ho, January, February, March, April, May.
Okay.
5.
So,
mabilis.
Yeah. Mamisan, well, philosophically, you can look at it blessing, na sandali lang siya, naghirap, no? And other would look at it sayang, di ba? Sayang. No? Okay. Pero usually yung mga pancreatic cancer, unless it's pag advanced stage, actually mas madali mag-decide, no? Kadalasan, just let it be na lang, no? Okay. But yung early stage, yan din mahirap i-decide, no? So you go for the major operation, and then you have a lot of chemotherapy going on, no? Okay. So, minsan, hindi mo alam kung it will really help or not, no? Yan ang hirap doon, no? Okay. 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 So any more questions? It's almost 3. Okay. No more, last call.
Wala na po.
So next Saturday, we will have what? Hemorrhoids. Okay lang sa inyo? Hemorrhoids?
Okay po.
Ah,
Okay, Doc.
okay. It's a common problem also, no? Okay. Okay, so we'll call it a day. Now it's 3 o'clock. Okay.
Thank you, Doc. Thank
Bye-bye.
you.
Salamat po. Thank you, Doc. Ingat po
Bye-bye.
kayo.
Thank you, Doc.
Thank you.
Thank you. Thank you,
Bye-bye.
Doc. Bye.
Mhm. Okay, I'll shut this off already. Bye-bye. See you.